Hi, I'm Chris Walker. I'm a physio at the Mobility Centre in Nottingham. I'm working with amputees. I've been working in amputee rehab for about 3 years now.
So what's the prevalence of lower back pain in your patient group, Chris?
To be honest, I'd say that low back pain is probably present in quite a lot of the amputees that we see. It probably comes on at some stage, but however, the amputees that we also see tend to have a lot of different comorbidities throughout. So they may already have had low back pain, they've had other problems associated. So it might be a case that they've got it, or it kind of comes on, but it tends to be more with the kind of mid-range population that tend to be a little bit more active, that want to get up and get going, and that potentially will have more of an incidence of low back pain than the others.
So the middle age group?
Yes, I would say so, yeah.
Yeah. Do you think it's more prevalent in above knee amputees or below knee amputees, or males or females?
I'm not sure whether there's a huge difference really. It seems to be the people that we've seen potentially might be more indicative to have them with above knee, just simply because of the extra expenditure and maybe extra use of torso and things like that they're using to walk with the prosthesis. However, there doesn't, in my experience so far anyway, there doesn't seem to be a huge difference in terms of male and female, anything like that.
Do you think lower back pain in amputees is as problematic as phantom limb pain or other associated problems which amputees face?
No, not really. Like, it tends to be phantom limb pain and contractures and wounds and things like that. They seem to be the big issues in the immediate kind of primary post-op and prosthetic phase. Potentially further down the line, when people become maybe more advanced prosthetic users, it might become more prevalent, but in the initial stages, the bits that we really see, I would say phantom limb pain is far outweighs it.
And how would you manage a patient, an amputee patient with lower back pain?
The same way I would do any back pain patient really. Obviously there's other factors to take into consideration. If the prosthesis is fitting correctly, if it is the correct length or alignment. However, all the other indications you just assess exactly the same in terms of movement, muscle strength, joints and things like that. So.
Do you think that the changes in prosthetics or advancements in prosthetics have changed the prevalence of lower back pain in amputees?
Yeah, I mean, I'd say it's difficult to say. So I guess the more advanced prosthetic users, we in the local kind of disability centres, mobility centres, things like that, we don't see maybe as much of, or the advanced users anyway. However, the advancements in prosthetics would mean that it's hopefully a lot easier for people to walk. It takes a lot more of the onus off the person and puts a lot more on the kit or machinery sort of thing, which would hopefully mean it'd be a lot easier to walk with, hopefully discounting then the back pain as well. So it's difficult to say, but I would say that largely as things change and develop, they'll make it easier for people to walk, which hopefully would mean less chance of people getting back pain as well.
Do you think that amputee patients with lower back pain present with more yellow flags like anxiety or depression?
I wouldn't say just with low back. I think amputee patients present with yellow flags in general, and yes, it might heighten it slightly, but they're going to be similar sort of yellow flags to what they've already got anyway.
Mm-hmm. And how would you manage a patient with yellow flags in this setting?
In this setting, we tend to talk to them a lot. We tend to be there, become their counsellors, but then we've also got different means of referring on if we think they need more specialist help. So here we've got the CBT team that can look at patients. We've also got support groups, and then we can refer on to different community groups and back into GPs and things like that. So those are the sort of things that we try and get them involved with, as well as obviously getting them involved with the patient when they come to the centre as well, and then our in-person experience.
Okay, that's great, thank you.